You're pulling my leg, right? Yes, today we're going to talk about mechanical traction, lumbar spine mechanical traction. So not really pulling your leg, but pulling your back. So in today's video, we're going to talk about mechanical traction for the lumbar spine in response to how effective it may well be for lumbar radiculopathy, which is basically where you've got a trapped nerve effectively in your back. So it's often caused from disc prolapses or stenosis or variable things that can basically impinge upon the nerve root and cause symptoms that radiate down a leg in the dermatome. So that's where the patch of skin supplied by that nerve would be. Now, mechanical traction is something that we were taught at uni and something that we've seen a lot of way back in the past, a lot more than today. It's not utilized as much. And in fact, these things go in cycles, they fall in favor and out of favor and so on. Now, one thing that I've always known about mechanical traction is that, if you've got a nerve being impinged at the nerve root and you pull on that area, as in you gap it, you'll relieve that nerve a little bit. But it doesn't always work that way. I've seen people where you think, if I pulled, it would relieve. And it irritates because the nerves are so stirred up. So a bit of pulling on the traction is stretching into the nerves themselves, and that causes some irritation. Now, this is what I've seen in practice, and I think I don't use it very often, but sometimes you kind of think, well, they're really stirred up as soon as they're weight bearing, and maybe just giving them some relief might give them some relief for a period of time, which then enables them to do their exercises, enables them to start getting things going. Obviously, in isolation, the traction may well not necessarily stack up to much, but used with other things, it may be good. But what does the research say on this? Not just what I've found in my practice and what I've found in the past, but what does the evidence say? So here there was a systematic review and meta-analysis to look at just this subject. Now, 8 studies met the inclusion criteria and 5 were meta-analysed. Now, the meta-analysis studies were of low quality, so again, we've got to look at that and think, well, this can't be 100% definitive, but researchers like this even with high quality, but this was low quality. And they did find that, mechanical lumbar traction was effective for lumbar radiculopathy, and they found that it reduced pain and disability when it was added to normal physical therapy or physiotherapy type modalities. Now, there were some high quality studies on prone mechanical traction because most of the time they are supine, and the first stuff I mentioned was supine. And they found that basically the high quality studies on prone mechanical lumbar traction were not significantly effective at reducing pain and disability. Now, these results weren't just for the super short term, as in you do it and you feel worse within a few hours or a day. They found that up to 3 months after the intervention that there was significant effect, obviously, for the supine version. And this shows you that, in combination with the normal physio kind of modalities, the exercise and so on, that this may be viable, certainly in a supine position as opposed to prone position, so basically facing upwards while lying down. So overall, if you've got a patient and you're kind of struggling with them, they're very stirred up in weight bearing and they can't really do their exercises, and you've done lots of other things, it might be worth trying some supine mechanical lumbar traction just to see if it gives them some relief. At the end of the day, it's not going to make them worse really, so you might as well try it if you're struggling, and you never know, it might be sometimes something that's very useful. And that's the way I tend to approach it. I use it infrequently, but I do occasionally use it, and it usually is because I'm thinking, they're really struggling, what else can I do? And I give that a go, and it can actually give them some relief in some cases. And this study shows that certainly in low quality research papers that actually this may be viable in certainly some cases for definite. So mechanical traction, pulling on your back, may well be a good option potentially in some cases. So give it a try if you're needing to do that. Anyway, that's it for this video, and I'll see you next time.